Welcome to the module Influenza or Flu Vaccine, What You Need to Know, Frontline Forces Training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. This course will provide a review of the flu and the flu vaccine and will build on your current knowledge of vaccinations. Direct caregivers play a critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning about vaccines and vaccinations and how to use this information. What you know and do improves the quality and safety of the patients you care for. This learning module, Influenza or Flu Vaccine, What You Need to Know, is part of a series of modules exploring different types of vaccines that are helpful in keeping both caregivers and the patients they care for safe and healthy. You are viewing the second module of the series, which provides a general overview of the flu and the flu vaccine. It is not necessary to complete the entire series in one setting. You can leave and return to any of the modules in the series at any time. Once you've completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you will be able to describe the complications of the flu, explain who should get the flu vaccine, discuss the importance of getting the flu vaccine, and describe side effects of the flu vaccine. The flu, also called influenza, is a contagious disease that spreads around the United States every year, usually between October and May. It is commonly spread to others by coughing, sneezing, and or other close contact. The most common symptoms of the flu include fever, chills, sore throat, muscle aches, tiredness, headache, and a runny or stuffy nose. Some people may also have vomiting and diarrhea, but this is more common in children than adults. Sometimes people with the flu develop more serious complications that may result in hospitalization or even death. Some of these complications include pneumonia, bronchitis, sinus infections, and/or ear infections. The CDC estimates that an average of 36,000 people died of the flu each year in the U.S. in the past decade. People from racial and ethnic minority groups experience higher rates of severe influenza or flu illness. Black people have the highest flu-related hospitalization rate. American Indian or Alaska Native people have the second highest flu-related hospitalization rate, and Hispanic or Latinx people have the third highest flu-related hospitalization rate. Those that are most at risk for flu complications include infants and young children, people 65 years and older, those that are pregnant, and people with certain health conditions or have a weakened immune system. Everyone 6 months and older is eligible to receive the flu vaccine every year during the flu season, except for those at risk for serious complications, which I will discuss later. The flu vaccine prevents millions of illnesses and flu-related visits to the doctor each year. In addition to possibly keeping you from getting the flu, it can also make your illness milder if you do get sick. This reduces the risk of hospitalization. For those that either care for or live with people with chronic health conditions, protecting yourself from the flu also protects others around you. For those who are pregnant, the flu vaccine also protects the pregnant person as well as the baby before and several months after birth. After receiving a flu vaccine, it takes about 2 weeks for protection to develop. Taking a flu vaccine reduces the risk of doctor visits due to flu by 50 to 60%. However, people with weaker immune systems do not always respond as well to the flu vaccine. There are many flu viruses, and they are always changing. Each year, a new flu vaccine is made to protect against the viruses likely to cause disease in the upcoming flu season. Even when the vaccine doesn't exactly match these viruses, it may still provide protection. In the United States, there are currently 2 ways someone can get a flu vaccine: by injection, or a shot, or via a nasal spray. Flu shots do not contain live flu viruses, so you cannot get the flu from a flu vaccine. The nasal spray flu vaccine does contain live viruses. However, the viruses are weakened, so they will not cause the flu. Most side effects from the flu vaccine are mild and include soreness, redness, and swelling where the shot is given, fever, muscle aches, and headache. As with any medicine, there is a remote chance of a vaccine resulting in more serious complications, such as trouble breathing, swelling of the eyes or lips, hives, weakness, fast heartbeat, or dizziness. There is also a very small increased risk for Guillain-Barré syndrome, or GBS, after the flu shot. GBS is a rare disorder where the body's immune system damages nerves. To help prevent complications from the flu vaccine, some people should not be vaccinated or should not receive some types of influenza vaccines. Anyone that has had an allergic reaction after a previous dose of flu vaccine, has any severe life-threatening allergies, or have ever had GBS should consult with their doctor before getting a flu vaccine. In addition, people who are moderately or severely ill should wait until they recover before getting a flu vaccine. For more information on the flu and/or flu vaccines, please refer to the resources on this slide. Included in these resources is a short influenza vaccination success story. Congratulations! You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the influenza or flu vaccine, What You Need to Know quiz on the Frontline Forces webpage or in the YouTube description below. When you have completed the quiz, you may want to let your supervisor know.